All right, well, this is awesome. We're here live at Health. We're not in Mars, we're in Los Angeles. This is super exciting. I'm the host of Planetary Health First, Mars Next, and we got Dr. Stephanie Lahr, president of Artisight. Super awesome. So glad you're here. We got Tom, who's leading a $100 million venture capital firm. So we're going to have a really good discussion here. Could you just quickly introduce yourself a little bit? You've done a lot.
Oh, sure, absolutely. So, Stephanie Lahr, I'm an internal medicine physician by background and training, practiced many years as a hospitalist. During that time, I got involved in informatics and the delivery of healthcare technology, also got board certified in that as well. Spent many years then as a CMIO, and because that wasn't quite enough, the last health system I worked for said, well, how about you be the CIO as well? And that was really awesome because the combination of those two jobs meant I could bring the synergies of the clinical and the informatics, but I also got to dig more deeply into the full technology stack that supports a health system. When I decided I had done those two jobs to the point that I was ready to try something new, I moved then into the vendor space. So 2 years ago, I moved to Artisight and became the president of the company, a company that I was working with as a customer on the CIO side and was just so passionate and excited about the work they were doing. I was like, hey, I'm going to take my efforts and do that all the time.
Cool. Where do we start? I mean, we had a great conversation in the green room about your technology, the vision and everything. Where do we start on this conversation?
Well, I think where we start is with the problem we're trying to solve. Right? The problem that we're trying to solve, from my perspective, is how do we bring the joy back to medicine? How do we bring the joy back to healthcare? And again, there's lots of amazing things that technology is able to bring into the healthcare setting right now, that automation is going to help advance, that AI is going to help advance. But our company, and for me personally, what I'm super dedicated to is this idea that it has to happen with our clinicians, not to them.
Sure.
And we really have to find a way to bring technologies in a dedicated, focused, and tailored perspective so it meets their needs. Clinical care is complicated, and you can't just throw random tools that are from open source areas and think, oh, I'm sure it'll help them. It helped somebody else in another industry. So it's really, kind of start with the problem at hand. What do we want to solve and how do we do it? And then what is technology's role in doing that?
Interesting. So I want to riff on something you just said. It has to happen with clinicians, not to clinicians. So I spent about 6 years at a large corporate venture fund on behalf of a large integrated delivery network, Providence Ventures. Shout out to those guys. That being said, learned a lot about physicians during that time, got to work with physicians during that time. It was a great time. But one of the things I kept hearing from them during lunches, roundtable discussions is, doctors aren't trained to use technology, right? They're just kind of thrown into it. They're like, hey, use the EMR. And they use it because they get paid for it, right? So they do the work and they just kind of learn as they go. Has that changed over the last 15 years? Yeah, it's been a while since I was that problem.
Yeah, I mean, I think medical education is starting to change by introducing technology elements into the medical education side. Certainly, just as a society, we're all leveraging technologies in a lot of ways that it just is kind of a part of our regular life. But I think one of the things that I want to move toward, I said this in an earlier interview today, in the early parts of my career as a CMIO, I felt like my mantra was, I can make it suck less. I mean, yay! So it's not really billboard worthy, right? I mean, it's like, yes. And honestly, the clinicians were like, yeah, I'm glad you didn't say anything more than that because we don't believe you. You keep giving us these tools that you tell us are going to help us, and they may help the patient, they may help the data we're trying to collect, they may help the billing aspect, but you didn't really help me. And so that is, I think, what's really exciting about where we are with technology right now, is we've got some technology that really can do that, can eliminate those burdens and reduce the friction for our clinicians. But I would love to get to a point like we are, and this is going to take some time to get there, but where when you get a new iPhone, you don't read a manual, take a 12-hour class, and then figure out how to use it. Like, it's got to be intuitive. If the tools are built right, if they're built into the workflow and we're bringing those things together and building them alongside clinicians and with them, then the likelihood is when we turn them on, they'll be like, oh yeah, I don't need you to tell me how to use this. It makes perfect sense.
So is that the goal of AI then, to try to make it more intuitive and kind of plug into the workflows and automate things that are intuitive?
I mean, I think that's at least a great place for us to start. You know, when we think about some of the goals of other places where we're leveraging artificial intelligence, like self-driving vehicles, autonomous vehicles. Sure, maybe someday the goal is that we can all get into a car and not think about driving it at all. But really, for the moment, the AI is there to help us be more safe, help keep us alerted to things around us, help prevent accidents, because as humans, we miss things. And so I think, you know, especially in these early adoption stages of AI and bringing it into healthcare, if we can focus on workflow improvements, care coordination improvements, that's a great way to build the trust and build the tech. We're going to eventually get to the point where diagnostics and clinical recommendations are coming out of the AI, and that will be amazing too. But I think if for right now, we could just allow clinicians to enjoy their jobs and focus on patients, that would be amazing.
Dr. Lahr, when you were coming in, you said you were a customer first with your, like, tell me what was that wow factor where you were just let in? And that was one question. And then also, like, how is it impacting patient care? That's sort of two questions.
Yeah. So in my mind, with this concept, so at Artisight, because we are essentially trying to replicate the human senses, right? So we want to be able to see and hear and speak and know where things are in space like a clinician, not because we want to replace them, but because we want to support their workflows, and we know we need that kind of sophistication in order to really be helpful to them. The idea in my mind of all of the different ways, all of the different tasks that are out there that nurses, physicians, surgical techs, physical therapists don't want to be doing right now and are not designed really well for humans to be doing, that those elements could capture. It was a brilliant aha moment. I actually, when I first heard about this company, I was sitting in a room with 6 other CIOs from other health systems, mostly through the state of California and a couple of others from some other states. And the CEO, now my boss, was presenting, you know, about Artisight. None of us knew anything about it. And when the presentation was done and he walked us through the operating room and how we could see that the patient was entering the room and that we could see these things were happening and somebody wasn't running over to a computer to click those boxes anymore, we were super impressed. And I remember a friend of mine was in the room and he said, he asked the CEO, could you just give us a minute, like, could you leave the room for a second so we can talk amongst ourselves? And he did, and as soon as he left, he was like, wait, is this not what we've all been waiting to see for years? Like this is, and so it was, and some of it's here today and some of it still we're building toward, but it was just a really inspiring concept. And again, for me, it was like, okay, well, this aligns with everything I want to do when I think about going from making it suck less to bringing the joy back to healthcare to being able to do that. When we think about the question of like, how does it impact care? How does it impact patients? It's funny because people's first reaction is to think, ooh, I bet patients and families don't like this, right? Because you're going to put cameras and speakers in the rooms. Like, I bet they feel like that invades their privacy. I'm like, do you think that the people that we have in and out of their rooms all hours of the night, checking them for all kinds of things, that's not an invasion of their privacy? I mean, like, the reality is in our hospitals, privacy is not an amazing element of what we do already.
Right.
But when we think about, again, and from a cameras and speakers perspective, we're not recording anything, so none of that is happening. But if we can leverage now a virtual nurse to support the bedside nurse, and that patient gets more care because they have more people on the team. If we can use fall algorithms to identify ahead of time that this person is at risk and get in that room in the middle of the night in the pitch black when nobody else was watching, that something is about to happen, and save that patient from a fall and a prolonged stay.
Yeah.
The patient experience things that we are seeing are, up and up and up. Patients feel like it is an additional safety blanket and an additional way to support their care in an environment where, it's already a complicated and a difficult situation from the standpoint of privacy, and their privacy expectations are not really around that they want extreme privacy. They just want to feel like things are, they don't want it to be as invasive. And this actually allows it to be less invasive.
I feel like this is like a paradigmatic shift or a perspective shift to how care is going to be moving forward. Would you say it's kind of like pivotal moment?
Yeah, I think in the next 5 years, I think every hospital room in this country will have a camera, a speaker, and a microphone.
Yeah.
Wow. Okay.
I think it has to happen in order for us to bring, again, the automation that's going to be needed at the bedside. And that bedside automation is going to require those kinds of sophisticated IoT sensors to capture information and provide that support. I also think we're going to see continued expansion of how we define virtual care.
Yeah.
And so we're going to bring nurses and pharmacists and physicians and physical therapists, possibly. I mean, all kinds of clinicians are going to be coming into the patient's room, potentially virtually, to support the care, because some things don't require a person to be in the room. And we're going to need to leverage that more and more. If we've already got a camera, a speaker, a microphone, and we can use the TV for two-way video, then let's leverage all of that technology for all of those things. Let's leverage it for telehealth and virtual care. Let's leverage it for training and deploying computer vision algorithms and those kinds of things.
Can you sort of opine a little bit or comment on cybersecurity as a topic? So I know cybersecurity is a touchy subject. I asked Lahr CIO back at Providence 10 years ago, and the data leaks are a big issue, right? PHI is a highly coveted thing. HIPAA is a very strict protocol. I mean, AI is sort of like data collection on steroids, right? And there's more, I guess, opportunities for leaks. And then can you sort of unpack what sort of things do companies need to keep in mind?
Yeah, I mean, I think this is a really good reason for us to continue to keep our eye on the ball around governance. Governance is such
of AI or the data or both?
Well, broadly speaking, right? So I think that governance is such a not so sexy topic. It can be boring and time consuming and tedious. But the reality is the best protection of our data is for us to understand it and to control where it is, when it's there, and know as much as we can about it. I think it'll be interesting because I think there will use some AI tools to help us gain those additional understandings, to help us be able to determine where and when data should be at, and putting it in those places so we reduce the potential for it to be infiltrated. At the same time, we have to be really mindful of the fact that the folks that are trying to get to our data are going to be leveraging artificial intelligence against us in the same way that we are going to be trying to use it to protect. So, I mean, I think I don't know that AI really is doing anything, honestly, but it's just further complicating the landscape. I think it's going to provide us some opportunities, but it's also going to provide us some risk. And that's where, again, I think we've got to go back to the basics of governance. Health systems need to understand what they're doing, where it's at, when it's there, and what tools are possible to be able to use to mitigate as much of the risk as possible.
Another question here, kind of related to governance to some extent. How about regulatory matters? Do you feel that the regulatory bodies understand AI well enough today to kind of get with the times, or are there some challenges ahead?
Yeah, I think that I think right now there's enough of an understanding for us at least to get a regulatory framework. And, you know, the old expression of don't forgo good for perfect. Right? I mean, like we need to come together on setting some regulatory standards, even if that means they're going to evolve over time. All of our regulatory standards evolve over time. We want to be smart about it. But, you know, I was having a conversation with someone earlier today who was remarking that the worst thing that could happen would be, from a federal perspective, for us to be worried that we don't know enough, that we don't act.
Yeah.
And so the next thing that happens is our well-intended states go in and try and enact their own. And now every company, every health system is trying to figure out 50 different ways through 50 different states to manage a regulatory landscape. And that is going to fail. There's no way that we'll be able to support that. So we need the federal government to dig into this, to support this. We probably will make some missteps in how those initial regulations roll out, because that's just typically the way that it works. But again, I think it's one of those areas where we need to do something and then calibrate forward or back, so that we don't put the states in a position of feeling like they need to do something themselves.
Sure.
So I think, we need the government the federal government to step in, and let's hope that they're bringing in the best experts that they possibly can from all aspects of the continuum, whether that's the care delivery teams, whether that's the technology teams, whether that's the data science teams, the ethicists, all of them need to weigh in, and the cybersecurity teams, on helping to support what this regulation should look like.
Well, this has been great to have you, Dr. Stephanie Lahr. It really has, Tom, to have you on with this discussion. Is there anything, as we're wrapping up, that you at Health, what you've seen, any takeaways?
I'm gonna let you go first. I've done a lot of talking.
Takeaways? So I think, we have a big AI, IoT kind of investment strategy, right? I think we're just trying to figure it out. So we're in we knew there was some froth a couple of years ago, and there were some hyped up valuations in the space. And so from a value kind of portfolio construction perspective, we've sort of laid low. But I like what you said today, which is, and it was actually in the green room prior to the call, which is baby steps. Right.
Yeah.
So those are the areas of opportunity that we're looking for. We're not looking for the one that's, hey, I'm going to transform the entire industry. We're going to solve it all day one. That might be a little too much for the doctors.
Absolutely.
Where are the automation tools? Who are the soap note operators? The automation of soap notes for doctors. I love companies like that, like
Absolutely.
Bridge.
Yep.
They just announced $100 million financing and stuff like that. These are the companies that we're really excited about. It might be natural language processing. It might not be generative AI just yet, but we're, like you said, we're making baby steps in that direction. That's probably my biggest takeaway here on day 2.
Yeah. And I would say that while I think there's still a huge amount of excitement around what these kinds of advanced technologies, AI, machine learning, whether computer vision, NLP, ambient listening, all those things, there's a lot of excitement around it. The reality is the health systems can only pay for it if we can find a way to develop an ROI that brings value early. Because if we set our sights on something super lofty and exciting, that's 5 years down the road, we're not giving them something that allows them to get in the door today, which is what it's going to take in order to get to where we want to be in 5 years. So we've got to translate that.
Good call out. Awesome.
This has been great.
Yeah.
Thank
Thanks
you
so much.
Thank you so much.
Yeah. Great to meet you.
This was awesome. Awesome.